Knocking. Hi Bill, my name is Carl. I'll be the nurse today. I'm gonna wash my hands. Bill, we need to change your PICC line dressing. I see that's in your chart and it's due to be changed. Do you have any questions about that, Bill? Yeah, he doesn't. Bill, can I just have you verify your full name and date of birth for me? And he does, and it is correct to what it says on his wristband. Bill, do you have any allergies, any cleansing solutions or latex allergies? Says no. At that point, I'm going to go ahead and wash my hands again. I will put on some gloves. And I'm just going to do a site assessment, checking for any redness, edema, ecchymosis, drainage, and approximation. I'm going to palpate the area for any tenderness, swelling, infiltration. Everything seems fine. He's not having a problem with that. So I will measure 6 inches up from the site of insertion. And mark off there. And then I will flip around and measure circumference in centimeters. And we have about 25 centimeters. So that is something I will want to chart to compare to baseline. If there's a half centimeter increase from baseline, we would be worried about a blood clot, infiltration, infection type thing. So that is something I want you to remember to document. You can also measure from the site of insertion of the catheter to where the hub would be, which in this instance there isn't one to measure. We'll say it's 3 centimeters or 3 millimeters. So just for today's skills video. So that's good. Just to go over a couple things, Bill, while we're doing this, if you have any questions, feel free to ask. But you and I are both going to have to wear a mask. If for health reasons you can't wear a mask, I would need you to turn your head to the left and stay that way. Anytime I'm taking this off while it's exposed until I get the new bandage on, you can wear a mask, so that's fine. If this was a little child, we would maybe want another nurse to come in, help hold the arm, maybe the parent to keep the mask on the child or help keep their head turned while we're doing this, because as soon as this is exposed, we don't want them to pull their arm away, cough, sneeze, breathe on it, contaminate the area. So I've got my measurements, I've checked my RITA, site assessment, and patient is in compliance, understands everything. I'm going to wash my hands, put on clean gloves. I'm going to open my sterile kit here, pulling away from me, without going over the top. I'm going to take the mask out. I'm already wearing a mask, otherwise I would put a mask on myself. Re-sanitize my hands. I do have gloves on, so I would take those off. Re-sanitize my hands. I would grab a mask, give it to the patient, help him put it on if he can't do it himself. Otherwise, he can put that on. He's wearing a mask. Going to re-sanitize my hands. Get the latex sterile gloves out, which I have a pair extra here because the kit gloves don't fit my hands very well. I do not need this extra. And I am set there. So now, re-sanitizing my hands, putting on clean gloves. I'm going to peel up the adhesive around the corners here, working my way inward of all the edges. And Bill did say he doesn't have any allergies to any cleansing products or tape, so I don't have to worry about that. And I want to be careful not to touch anywhere near underneath to contaminate the site, so I'm always staying on top, peeling inward. When I get down to the bottom here, I want to kind of hold down with my thumb and pull up, so I'm not pulling on the catheter. And peel in a little bit more until I'm right on top of the hub or the insertion site. And then peel up and away. So now that that's off, you can assess the dressing for coca, color, odor, consistency, and amount of any type of drainage that would be on here, which I would need to document along with my RITA. That can go in the garbage. Going to take off my clean gloves, wash my hands, and apply my sterile gloves. Making sure I don't contaminate my gloves. Hands are clean, like I said, I washed them. Might be a trick with gloves on. One. And two. And want to maintain my hands above waist level, making sure not to turn my back in my sterile field or anything. I have my alcohol wipe and my tweezers forceps. I'm going to hold the line in place. I'm going to start cleansing around the insertion site, working my way outwards, going underneath, same thing, getting as close to the insertion site without actually touching the insertion site as possible. You can use as many alcohol swabs, Q-tips as I need, depending on how much drainage there is to clean up. That's clean. I'll grab my chlorhexidine prep wipe. I would activate it by squeezing these so the cleansing solution can run out to the top. I will hold this in place and scrub, pushing decently, but then again, if it's an elderly person with real frail skin, you don't want to push too hard because you can cause skin irritation. Cleansing underneath as close to the insertion site again as possible without going right on top of it. 30 seconds scrubbing, 2 to 3 inch margin, cleaning everything up around it. And that's done. These can both go in the garbage, and actually I might hang on to this just for a second because I can kind of hold the catheter out of the way again while I use my skin prep. And so now that that is dried, I'm going to skin prep around, kind of make a window around the insertion site without contaminating the area. That's just going to help protect the skin and help the adhesive covering to stick in place. And I do have our clear window PICC line, central line covering that we're going to use. Some facilities, or per facility protocol, they'll have a CHG square, a certain type of dressing that you need to use for this, helps keep the infection rate down. Peeling off the backing, and this is a no touch because we don't want to contaminate the window. Want to get the window of our film straight down over the center. I'm going to switch because I like it this way. We'll place that down right center over and just kind of push it down in place, covering it so that our catheter insertion site is right in the middle of the window. I'm going to peel off the backing, holding it all in place. Okay, so at this point, everything is held in place good. It is covered again. So I can remove my gloves. Take these off. And we'll go in the garbage. I sanitize my hands. I can take Bob's mask off for him if he's not able to himself, because now that it's covered, he can turn his head back and talk and look, whatever. Throw that in the garbage. Sanitize my hands again after touching his mask. Then I can grab my extra piece of tape here off of my adhesive. I will date, time, and initial this, and then you can use it as another piece of tape across the bottom just to help adhere it, because that's a lot of times where it's going to want to pull up. Like I said, my initials, the date, and the time. I would then make sure I've make sure the patient's in a position of comfort, doesn't have any more questions, has his call light, make sure everything's cleaned up. If there's anything that has blood or drainage, anything on it, make sure that's thrown out while I still have gloves on. Take my gloves off, wash up my hands again, and then I would chart the date, the time, the type of dressing used, my Coca and Rita assessments, and the measurements that I took of how far the catheter is out of the arm, and circumference of the bicep 6 inches up from the insertion site of the PICC line. And that is how you change the dressing on a PICC line.